Assalamu alaikum. Greetings to you all. In this video today, I'm going to read a scientific paper. Well, I'm actually going to read a part of the scientific paper because the paper is too long to cover in one video. I have already done 6 parts of this video series, and this video is the 7th part. And in this part, I'm going to start from the results section and subsection called optimization of scheduling, timing, and dosing. So without further ado, let's start. Optimization of scheduling, timing, and dosing. The success of the press pulse therapeutic strategy for the metabolic management of cancer cell will depend on optimization of the scheduling, dosing, and timing of the various diets, drugs, and procedures used in order to achieve maximum synergistic interactions, as shown in figure 2. Scheduling will involve the order in which the chosen pulses are delivered to the subject while under dietary therapy. Timing will determine when and for how long the presses and pulses are given, that is, like number per day, per week, per month, etc. Dosing will identify the optimal drug dosage needed to kill tumor cells while preventing or minimizing systemic toxicity. Scheduling for each of these variables can be adjusted for the age, sex, and general health status of the subject. The strategy should degrade tumor cell populations gradually to prevent tumor lysis syndrome, which could cause excessive toxicity. Tumor imaging procedures involving FDG PET, magnetic resonance imaging or MRI, and computed tomography perfusion CTP, as well as analysis of serum cancer biomarkers should be helpful in assessing therapeutic success. The goal of this press pulse therapeutic strategy is to improve progression-free and overall survival from cancer without producing adverse effects from the treatment. This is the figure 2, and you have to basically look at the figure to understand what it is talking about. Let me try to make the screen a little bit bigger. Hopefully that will cover the whole picture in one screen. Yeah, it pretty much does that. Anyway, let's continue reading after the image. Illustration of the press pulse therapeutic strategy for cancer management. The press pulse therapeutic strategy considers cancer as a singular systemic disease regardless of the specific tissue or organ system containing invasive or metastatic tumor cells. This strategy is designed to target the glucose and glutamine dependency of tumor cells while enhancing the metabolic efficacy in normal cells. Press therapies are designed to reduce systemic glucose availability while elevating blood levels of ketone bodies, which tumor cells cannot effectively use for energy generation. This approach pits the metabolic demands of normal cells against those of the mutated tumor cells, which are less capable than normal cells in adapting to metabolic stress from nutrient deprivation. Ketone body supplements could further reduce glucose levels while enhancing the respiratory energy metabolism in normal cells. Stress management techniques together with exercise could further stress tumor cell metabolism while improving general health. The press therapies would be designed to work synergistically with acute pulse therapies to further target glucose and glutamine metabolism. HBOT will work together with the press therapies to selectively increase oxidative stress in tumor cells. The spacing between the various pulse therapies is designed to stress tumor cell metabolism while minimizing toxicity to normal body cells. This therapeutic strategy will target the fermentation metabolism common to most tumor cells, thus gradually degrading tumor burden. The progressive color change in the the progressive color change in the Vitruvium man drawing from red diseased with darker red spots indicative of metastatic lesions to yellow reduced metastasis to green resolution symbolizes gradual metabolic management and resolution of cancer. The pill symbol is indicative of glycolysis targeting that could be delivered orally. The RX symbol is indicative of glutamine targeting that could be delivered intravenously. Pulse therapies would terminate the evidence. Pulse therapies would terminate with evidence from management or resolution, while press therapies could continue under modification or adjustment. Arrow. Optimization of dosing, timing, and scheduling of the press pulse therapeutic strategy will facilitate the eradication of tumor cells with minimal patient toxicity. This therapeutic strategy can be used as a framework for the design of clinical trials for majority of cancers. HBOT, hyperbaric oxygen therapy, KDR, calorie restricted ketogenic diet. That was the end of the thing, and basically this part was after the image, it was basically explaining the image, the figure that we saw. It was basically explaining that figure. So let's stop here because the next section is the discussion and conclusions. I'm going to do that or cover that in a separate video. So that will be part 8 of this series, and I think that will be the last video of this series. So I hope to see you in the next video. Take care then. Bye-bye.